Today I wanted to talk about your gait or your walking pattern. So really important thing is to get that extension, and that is the straightening of your knee. When your knee is completely straight, it should be at 0 degrees, and that's what you want to strive for following a total knee replacement surgery. So when we walk normally, our heel should hit the ground first, and then we should roll through our foot to the ball of our foot and our toes, and that's what we push off with for the next phase of the walking pattern. So again, we hit with our heel, we roll through our foot, and we push off with our heel of our foot and our toes. So that first step, when the heel hits first, is called heel strike. And then once we roll through and we push off with the ball of our foot and our toes, that is called toe off. So those are two of the phases that I'll be talking about today in reference to getting that extension at 0. So to walk properly, you need that 0 degrees so that your heel can hit the ground first. After surgery, sometimes what happens is your brain can start sending messages to the leg on how it should move and where it is in space, and your leg can sometimes have a delay on that message. So it's almost like your muscles have to relearn what their job is, your leg has to relearn what it should be doing when you're walking. So sometimes that can be part of the problem too. So sometimes you'll have 0 degrees of extension, you've been doing really well on your X10, but now you almost have to reprogram your brain on how to walk again. So again, you'll have to take a look at, how am I walking? What am I doing with my feet when I step? So, to kind of take a look at it, pay attention, start walking to what feels normal to you, glance down, see what your feet are doing. You want to make sure that that heel hits first, you're rolling through your toes. What happens is that relationship between your brain and your leg and with your foot hitting the ground is called proprioception. And that's that. With that relationship with your brain and your leg, it takes time to develop that again, sometimes after surgery. Why it's important is because your brain tells you where your foot is in space. So whether your foot hasn't hit the floor yet, or if it's just touching the floor, if it's about to touch a surface that may be uneven, these are all important things for your leg to get the message from your brain and to do it timely. So for an example, if you're stepping onto grass or you're walking on sand, your foot needs to know that before you step, because you need a little bit more balance to walk on those types of surfaces. So you need that good relationship going so that you don't lose your balance and that you don't start to waver. As well as if you were about to step up onto a curb, your brain needs to tell your foot how high should it lift so that you have good clearance. Sometimes you'll notice you almost lift too high because, again, you're not quite sure what to do with your foot. But most importantly, you want to make sure you lift high enough so that you don't catch your toe. Sometimes what happens before surgery is that arthritic pain that you were experiencing for so many years and for so long caused you to start walking differently. You'll develop a pattern that is not how we're meant to walk. So for an example, you are having a lot of pain on the inside of your knee, so it feels better if you walk on the outside of your foot to relieve that inside knee pain. Well, what happens is now we've changed the way that our bones are aligned, we've changed the way we're using our muscles, and we'll start to develop this pattern to avoid pain, but it becomes a problem, and it can cause hip pain, and it can cause knee pain, and it can cause ankle pain. So after your problem is corrected and you've had this surgery and you don't have that pain to avoid anymore, you really want to make sure that you have to reprogram your brain on what is a normal way to walk. So again, you might have great range of motion, but your brain has accepted your old way of walking as normal. So you have to reprogram yourself. Don't walk on the outside of your foot. You should be distributing your weight evenly through your foot and having good contact with the ground for your full foot, not just one side or the other.